Congratulations on the birth of your baby, and welcome to Lowell General Hospital Mother and Infant Unit. We are happy to help you and your family during this special time. To get to know your baby, it is good to keep him with you in your room. We plan your care so that you and your baby are not separated during your stay. Holding your baby against your skin will keep him warm and healthy. It has been proven that skin-to-skin contact will improve your baby's temperature, heart rate, breathing, blood sugar, and weight gain. It is a great way to bond with your baby and to keep your baby happy. Women who practice skin-to-skin contact have better success with breastfeeding. The Mother and Infant Unit is a safe place with locked doors that have video cameras. You, your baby, and Dad or the support person will have identification bands with matching numbers. Parents will be given a swipe card that will let you into the unit and nursery. Please return this card before leaving. A special clamp is on your baby's umbilical cord for safety. This clamp will allow us to track where your baby is at all times. If you delivered vaginally, you will be here for about 2 days. For mothers who had cesarean birth, you will stay for 3 to 4 days. You may call for food by dialing 6325 between the hours of 7 a.m. to 6 p.m. There is also a small kitchen on the unit with ice, water, drinks, and a few snacks for patients. There is a button to call your nurse when you need her. Please call to get out of bed for the first 2 times. We will help you to the bathroom and make sure that you are strong enough to walk alone. The nurses will also teach you how to care for your baby. The baby's father, brothers, sisters, and grandparents can visit you any time of the day. The father of the baby or support person can spend the night. All other visitors can come between 1 p.m. to 8 p.m. Your baby will have a hearing test, blood test, and a hepatitis vaccine while in the hospital. A photographer will come to your room and offer to take your baby's picture. There is a birth certificate worksheet that will need to be completed in order to give your baby his legal name. And there is a form you can fill out if you want to announce your baby's birth in the local newspaper. Afterbirth pain and bleeding. After you have your baby, you will have bleeding from the vagina. The first few times you go to the bathroom, your bleeding may seem heavy. Your nurse will help you until the bleeding slows down. After that, it should not be much heavier than your period, and it can last up to 6 weeks. You may have pain in your belly and vaginal area. Call your nurse when you need pain medication or if your bleeding seems too heavy. Perineal care. After you go to the bathroom, use the squirt bottle from the hospital. Fill it with warm water and use it to rinse the blood away. Always remember to wipe or to pat gently from front to back. Change your pad often. Continue to rinse with your peri bottle at home until your bleeding is light. Vaginal birth. You can use ice on your bottom to help with swelling on the first day. Your nurse will show you how to apply medication to this area to help with pain. If you had stitches, they will dissolve on their own. After the first day, your nurse will show you how to use a special sitz bath that goes on the toilet. Fill the sitz bath and the bag with warm water and close the tube with the white clip. Then you can sit down and open the tube with the white clip. Do this for about 10 minutes, at least 3 times a day, while in the hospital and at home to help you heal. Cesarean birth. You will stay in bed for about 8 hours after surgery. Make sure to take deep breaths while in bed. If you need to cough, hold a rolled up towel or blanket to support your incision. It is important to move your legs a lot when you're in bed. Tell your nurse if you want pain medication because it helps you get better faster. We also have medication for itching and nausea, which some people experience. We will increase your diet to solid foods as fast as you can tolerate it. You will have a needle in your arm or hand to replace your fluids and to give you strength. We will take this out once you are drinking enough fluids. You will have a tube for 8 to 12 hours that drains urine. Once the tube comes out, your nurse will help you get out of bed and go to the bathroom. It is good to sit up in the chair or walk in your room and in the hallway when you feel ready. Many mothers get gas pains after surgery. Drinking warm fluids and walking will help you. The dressing covering your incision will be taken off after the first day. Your incision might have tape covering it. The tape will stay on for about 1 week. The stitches that were used will dissolve in your belly. If you had staples, your doctor will take them out in about 1 week. Make sure to dry your incision well after the shower. Breast care. A few days after your baby is born, your breasts may feel bigger and heavier. This is normal. Using a supportive bra will help. In the shower, wash your nipples with warm water. Avoid soap, as this can irritate and dry your nipples. Your nurse will give you a special cream to help with nipple tenderness. With engorgement, your breasts may become painful, hot, and hard. This is temporary. Continue to breastfeed as often as you can to help empty your breast. If you are bottle feeding, a good bra and ice packs will help. Baby blues. It is normal to feel sad or to cry during the first week after you have a baby. You may cry more when your milk comes in. This is normal. But if you feel sad for longer, have difficulty caring for yourself or your baby, you must call your doctor. If you think about hurting yourself or the baby, you must call your doctor. He or she can help you feel better. Caring for yourself at home. Make an appointment with your doctor for 6 weeks after the birth of your baby. While at home, drink at least 8 to 10 glasses of fluid a day to prevent constipation, especially for breastfeeding mothers. Get plenty of rest. Avoid tampons, douches, and sex until you have your 6-week appointment with your doctor. Reasons to call your doctor after discharge. If your temperature is over 100.4. If you have a red, sore, or hard area in your breast, especially if you also have flu-like symptoms. Heavy vaginal bleeding or bad-smelling discharge. If your pain gets worse or is not relieved by medications or comfort measures. If your incision is draining or is red, hard, warm, or swollen. Pain, cramps, redness, or increased swelling in your legs. If you develop a new onset of headaches, dizziness, or visual disturbance. If urinating becomes painful, difficult, or too frequent. If you become constipated. If you feel sad and can't take care of yourself or your baby. On behalf of Lowell General Hospital, we would like to thank you for choosing to deliver your baby here with us. We are happy to help you during this special time. We hope this video has answered any questions you might have about caring for yourself in the hospital and at home. Our goal is to prepare you for a happy and healthy start together. We wish you and your family all the best.